So this is Eric Bruns. I'm here in Seattle, where predictably it's 44 degrees and raining. I'm hoping that things are a little sunnier and warmer in the, what is it, the Magnolia State? Is that what Mississippi is?
It is.
Good job.
Yeah, but no, it's not any warmer. It is sunnier, but not warmer.
Really? It's chilly, huh?
Like, yeah. It's 50. It's close.
If it's sunny, that sounds nice to me. So, so I'm up here in the far upper left-hand corner of the country doing a lot of stuff with my team and with the Institute there at University of Maryland on wraparound implementation. And what we spend a lot of our time doing is developing quality and fidelity measures. Previous to developing these measures that are intended to help keep teams and programs on track, we spent a lot of time doing basic research on wraparound to try to ask what the characteristics of high quality wraparound that gets good outcomes for kids are. And so as part of that work in about 2004, we founded something called the National Wraparound Initiative that is a clearinghouse for information on wraparound implementation. Back then, it was a way in which we brought all the experts in the field together to define what the model should consist of and how best to measure quality and fidelity. It's been a really wonderful 10 years, and core partners in that work from the beginning have been folks like Kim Estep, Michelle Zabel, Marlene Matarese, and others at the Institute, which is now kind of the NWI's primary way of getting states and big jurisdictions trained and coached up to do the evidence-based model. So that's just a little bit about me. I think I'm the only one from the team here. There's about 6 of us at UW that are on this webinar. But maybe I could hear who others are on the call. So Kim has sent me an email saying who's on, but just hear put a voice to a name.
I'll start. Hi, Jennifer Grant. I am the director of the Community Alternatives to Psychiatric Residential Treatment Facilities Demonstration Grant, and that program will officially end services next September. So I'm hoping in the meantime, wraparound will be my permanency plan.
I like that.
Yeah, I'm the director of that demonstration project here at the Division of Medicaid in Mississippi. And I'm just, I love wraparound. I love what the Institute has introduced in our state and what the Wraparound Institute has also been able to provide for our families as far as, feedback through these tools and the monitoring component. So I'm excited.
That's great. Thank you, Jennifer.
I'm Emmanuel McDonald. I'm the MyPAC Care Coordinator here at the Division of Medicaid. I am diehard wraparound friend, family. I like to monitor the workers who participate in the MyPAC program across the state to make sure they are implementing wraparound effectively.
Wonderful. And is it manual or Emmanuel?
It was actually Emmanuel. The E is
Emmanuel.
But nobody ever says it.
Got it. Thank you. Nice to meet you.
Nice to meet you.
I am Elizabeth McDowell. I am the State Wraparound Coordinator with the University of Southern Mississippi.
Yay!
I'm new to the role, so I'm just really excited about getting started and seeing, how all this is going to work for our state.
All right. And
Wonderful.
I'm Kim Coviello with the Institute. I know you, Eric, so hi, nice to meet you.
Who are you? I don't know who you are.
And I do want you to know that we made sure that they all drank the wraparound Kool-Aid before this call. We've been giving them small doses of it over the last, few years, so it sounds like it's been working. So we're all really excited about kind of where Mississippi is, and so I'm thrilled that they have just really bought into this hook, line, and sinker, and I think we have a great plan moving forward.
Great. Yeah, it certainly sounds like it's been quite a success story. And I think it's maybe down there, is it the wraparound sweet tea instead of the Kool-Aid or something like that, maybe?
Ooh, I like that. The wraparound sweet tea.
Yes. Nice.
I pretend I'm from the South, being from
program.
Virginia, but it's not that far south. I'm sorry. Go on ahead, Arnica.
I'm Arnica Bird, the program manager at the University of Southern Mississippi, and I work along with Elizabeth and Jennifer and Emmanuel on the Wraparound program.
And
Nice
yay,
to meet you.
Arnica, you helped get this all started here for the USM team.
Yes.
Yes.
And hopefully we'll be on in the next 10 to 15, 20, 35 minutes or so.
We'll give him that window of leisure.
I like that. 10 to 35 minutes. I like this.
I think that's it here, huh?
I think that's all.
That's all.
Okay.
Well, Sarah, did you want to introduce yourself?
Sure. Hi, guys. My name is Sarah Medier, and I'm at the Institute, and I'm new to Wraparound, so I'm still figuring it out. I'm really excited about this webinar so I can, learn even more about it.
Probably I heard it all already, Sarah, but I'll bear with me. We'll go through a little bit again.
All right.
Okay, is that it? And then we have Kim and Adam as well, right?
Yes.
All right.
Yes.
Okay, well, today what I think I was told to do was to kind of provide folks at USM, and Sarah too, of course. Can everyone see the screen advancing here to agenda?
Yes.
Yes.
Okay, so we did our introductions. I think what we're doing here today is try to tell a story pretty quickly, record it for Tim's purposes later, orient those who haven't been exposed to this information a little bit more, and those of you like Jennifer, it sounds like maybe others as well, Emmanuel, know the basic idea behind the need for measuring fidelity and skill development of staff. But we're going to talk a little bit about how we think it should look in wraparound so that everyone's on the same page. You can use the recording of this webinar to bring new partners there in Mississippi up to speed, because it sounds like you all are really building an infrastructure there to not just train and coach your staff, but also to measure fidelity and outcomes, which is wonderful. So we'll look at the framework for fidelity, talk about the tools, and then more than anything, just discuss what are different evaluation approaches. I might pull up, since I have control here, pull up a couple documents that help walk through some of those options for how to use these fidelity tools if we have time and if you think that that's something we want to do today. So that's about it. It's going to be me talking quite a bit for at least a half an hour, and then we can start getting into the discussion part. Does that sound okay?
Yes.
Yep.
Is that what we're trying to do, Kim?
Yes, sir.
All right. So starting off with just like, why do we do this wraparound stuff? Why do we do fidelity monitoring when we do wraparound? So, the very brief history is that in the 70s and 80s, wraparound was something that was a radical idea in a few corners of our country to try to keep kids in the community even when they had very serious emotional behavioral needs, and to provide comprehensive community supports rather than institutionalization. So this was going on in Alaska with John Vandenberg, and Chicago with Carl Dennis. North Carolina was the first place that wraparound was used as a term, something that was coined by Lenore Bahar as they were building intensive community services in response to the Willie M. lawsuit. A lot of lawsuits out there that get wraparound implemented in states all the way back to the 80s. So this was something that went on for at least, 10, 15 years with the term wraparound, but it was really just a philosophy, and there was concerns that we didn't really know what it meant to actually do wraparound, which meant we didn't know how to train folks to do it, didn't know how to research it, didn't know how to measure it. So what we had was a situation where then people came up with some principles, and these are the current principles of wraparound. Families have voice and choice. You use a team. Natural supports are meaningfully involved. You encourage collaboration among all the people who are paid to care for these youth, as well as those who are part of their family and community. And you do things like measure outcomes all the way along the way. We had these principles, and we'd seen some examples of positive places where positive outcomes occurred, but really this was our theory of change. Just we all know the principles, live them, teach them, talk about them, and then a miracle is just going to occur because we all stand by these principles, and that's how we're going to get to positive outcomes. Well, that's not usually the best way to take an innovation to scale statewide when you're actually talking about needing to fund it, train people, bring, you know, what might be dozens, if not hundreds of staff up to speed in a state. So we had to move forward with a different approach that built on those principles and philosophy and the basic ideas, but gets a little bit more rigorous about how to do it. So like I was saying, in 2003 we had the first meeting of the NWI, and we tried to start getting the experts together to describe what the activities of wraparound teamwork actually are. Okay, and if you want to read all about the history and all of the materials that we've got at the National Wraparound Initiative website, it's nwi.pdx.edu, or you can just Google National Wraparound Initiative. And here's our website, and we encourage folks to go there. All of the stuff I'm talking about here is included in much more detail on our website. Everything about the practice model, the research, Fidelity, etc. So here's just the 3 to 4 minute overview of wraparound, because we are recording this for future folks' use in Mississippi. So again, we have the wraparound principles, and I won't go over them right here right now, but there's tons of documents on our website that describe what it means to actually do these principles in the real world. Okay? But what was really important more recently, as I was saying, was to move beyond principles to talk about what does the actual process consist of. And so experts like John Vandenberg and Pat Miles and others kind of decided to define the activities of wraparound, or describe the activities of wraparound as taking place generally in 4 phases of work. Engagement and support and team preparation is the first phase. Then you have an intensive 2 to 3 week plan development phase. An implementation phase that takes place is the longest phase of work, and continues not for some defined period of time, but until adequate progress has been made on the priority needs that have been identified for the young person and their family. Whatever the needs are that the team is working on, when you've made enough progress towards those needs that the family can transition out of formal wraparound, that's when you then go into the transition phase. Okay? And again, on our website and all the materials I'm sure that Kim has provided you can give you a lot more details about these phases. But, you know, again, since we're recording it, here are some examples of things that happen. So in the beginning, the facilitator, maybe with a family partner, or maybe it's a family partner alone. Some states and places do it differently. But there is a first phase that happens before any team is convened or meets, where people meet with the family and stakeholders, primarily the family, the parent, the caregiver, and really just opens their minds and opens their ears and empties their minds, their heads, and just listens, right? Gathering the raw material for how you're going to engage this family, who the team members will be, what their strengths are, how they describe their needs. So this is a process through which so many helping professionals don't get the opportunity to do. This really characterizes wraparound and makes it special, is this engagement phase that really is just about getting this family perspective, getting the family story. You're also doing things like intervening immediately if safety or need for rest exists for this family and their family members. You're explaining the wraparound process fully, and like I said, you're pulling this information together into some summary material that the team will use. Bringing those folks together. Oh, so that's just an example of the engagement phase. I guess I'm not going to go through the description of all 4 phases of work. You guys are getting trained on it. You have materials. But the bottom line is that if you're going to do this process where you actually are capable of implementing activities such as these fully, if you're going to have an effective team that effectively does the practice model for wraparound, you also need supportive organizations that provide or arrange for the provision of training, supervision, interagency collaboration, and you need a hospitable system that has got the right kind of funding and policies, which is why the PRTF program is so important. Obviously, this is something that's intended to ensure that you really do have a permanency plan for your state in terms of the funding and policies that are in place to support organizations to implement effective teamwork. So one of the things that is really critical about setting up your system to support that intensive practice model is that we actually are assessing whether or not wraparound is done in accordance to that intensive model. So now here's where we start talking about the Fidelity process, right? So some of the things that we can do to be accountable and to ensure that we're always learning about whether or not this is getting done right. We want to evaluate the degree to which the practice model, so those phases of work and the activities in each of them, as well as the principles, how well are those getting done in practice with families? And so some of the ways in which we can evaluate whether the model is being done fully are interviewing or surveying staff and families, children, youth, caregivers, and of course facilitators and family partners. So interviewing or surveying folks about whether or not those activities have happened. We can observe teams. We can review documentation such as plans of care and strengths, needs, and culture summaries, progress notes, and so forth. So at least 3 different ways in which we can evaluate whether or not wraparound on the team level is actually happening the way it should. We also can evaluate the degree to which the system actually is supportive of wraparound, the degree to which systems and organizations are actually supporting wraparound practice by interviewing or surveying key stakeholders in the system to tell you about things like community partnership, fiscal policies, the adequacy of the service array, whether or not people are being trained and coached and supervised adequately to implement this stuff, okay? So this is kind of a little, this is the framework for fidelity monitoring and quality assurance, is that we want to be able to evaluate how well it's going at the team level or the family level, and we also want to be asking about system supports and system outcomes as well. And I'm going to pause in a moment here, but the last thing I'll say in terms of the setup here is that in order to do these things, in order to interview or survey families and staff, observe team meetings, get those stakeholders interviews, get those stakeholder perceptions, we have 5 primary measures in what we call the Wraparound Fidelity Assessment System. We have interviews that are fairly intensive and done by trained specialists called the Wraparound Fidelity Index, which I'll go over in a second. We now have a brief version that's a survey, a self-report survey of the WFI called the Wraparound Fidelity Index short form, or as we like to call it, the WIFI Easy. We have the Wraparound Team Observation Measure. We have a document review measure that we customize to each state or community that wants to use it. And we have a community supports for wraparound inventory that is a survey of stakeholders called the CSWI. So I'm going to pause because that's really the intro here. A real quick, like I said, 10 minutes on what is wraparound. Why are we, I'm going to talk now about why we measure fidelity, but that's kind of the basics that I'm going to talk, now go over in a little bit more detail. Any questions, or does this sound new or really old or whatever for anyone out there?
It sounds very relevant, so I'm just, I'm intrigued. I'm drawn in. It's very relevant.
Okay. Any questions from anyone before I continue? All right, so why do we do this work? So here's just a kind of little teaser about what we do, these interviews and observations and doc reviews and stakeholder surveys. Here's the tools, okay? So why do we do this? I'm going to tell you why, and again, real quick, just since we're recording this for folks, my assumption is that Tim is a research-based guy, being a dean of a school of social work, so he might want to just kind of get a picture of the research behind this. Not so long ago, there was only a couple of studies of wraparound, and they weren't particularly rigorous. We now have 10 studies that are controlled out there in peer-reviewed journals, and more are in the pipeline as we speak. If Mississippi wants to be a place that contributes a new one, then please, let's have that conversation, because we really do need more research about real-world implementation in places like states that are taking this to scale. But right now we've got 10 studies, and 8 or 9 of these are unequivocally positive, with positive effects in different outcomes for wraparound. For those of you who are research geeks, or anyone who wants to view this later who is, this just basically shows how across those 10 studies, we looked at the outcomes in 4 different areas: residential placement or living situation, mental health outcomes, school functioning, and community functioning. What you see here are these blue bars are the effect sizes in each of these outcome areas. And anytime that you are above about a 0.2 effect size, you're talking about something significant. For living situation in particular, we have a very strong and significant effect for wraparound. We have significant but somewhat smaller overall effects of wraparound for mental health outcomes, school functioning, and community functioning, which is really primarily juvenile justice recidivism. So the bottom line here is that if the effect size was 0, it would mean that on average there's no difference between wraparound and services as usual. When you get positive effect sizes, it means that you have a positive effect for wraparound. And you can see in all 4 of these areas we have a positive effect for wraparound, with the strongest one being in the living situation area. In addition, we see outcomes that are really strong, particularly strong for costs to systems and residential outcomes for families. So I'm not going to go into the detail here, but some of these are not controlled studies, but they're really compelling. So Wraparound Milwaukee reducing their hospitalization from 5,000 days to less than 200, as well as RTC placement. In Massachusetts, a study found 74% lower inpatient expenses for a wraparound group. The waiver demonstration project that you all are participating in had an evaluation. They estimated that the average per kid savings for the kids in the PRTF group, or the community services group, the wraparound group, was $20,000 to $40,000 per kid. And it just goes on and on. New Jersey has found cost savings, Maine, Los Angeles County. So this is where we really see these positive effects. And we also have found now, seen wraparound being added to more and more inventories of evidence-based practices that are out there. State of Oregon, State of Washington, California Clearinghouse for effective child welfare practices all list wraparound. But here is the key. One of the most respected inventories of evidence-based practice is the Washington Institute for Public Policy here in our state. And they made sure that what was listed in the inventory is full fidelity wraparound. And this is because our research shows that fidelity really matters. Quality and fidelity, staff skills, what the families actually experience can be very different from place to place. Some places say they're going to do wraparound, but families get the runaround. Some places say that they're going to do wrap, and they get something that rhymes with wrap. We have to avoid this because the research shows that if you are not actually doing the full process, if you don't have systems and organizations that are set up to support wraparound, the outcomes are not going to be as strong, right? So, I don't know, I went on the internet and was stunned to find that Cicero, back in ancient Rome, was talking about wraparound fidelity. He said, nothing is more noble, nothing more venerable than wraparound fidelity. Oh, I guess he wasn't really talking about wraparound fidelity, but faithfulness and truth, it is pretty much what we're trying to achieve, is being faithful to the model. And that's why you've got folks like Kim and Kim Coviello down there, is to get your staff really well oriented to how to implement things faithfully. Why? Because we have seen that the more close to the model a family, the closer to the full model that the family experiences, the more likely they're going to improve. So this is data from Indiana. 82% of kids who got high fidelity wraparound on these tools that I showed you before improved. When the fidelity was only adequate or borderline or below acceptable, the percent that improved was really getting down to just about a coin flip whether or not they got better or not. And that's not good enough. Oklahoma's found the same thing. This is kind of a hard graph to interpret, but what it shows is the higher your fidelity score on our tools, this is from the Wraparound Fidelity Index short form, the WIFI Easy. This is like, 80 or I don't know how many this is, 50 families, and what they're plotted on is how much did their problems change in the positive direction would be going down against how high is their fidelity. So you can see that these families whose fidelity scores were in the 80s to 100s are much more likely to be down here where they had huge improvement in their problem behaviors. If you're getting lower scores in fidelity, you're more likely to be up here where your problems are actually increasing. So I think you don't need any more. This is common sense, but this is the research behind it, that we need to achieve good fidelity, and we need to make sure that our states or our systems are set up to provide consistent, enduring supports. This is one last piece of research, and then I'll quit with the research. This is from Nevada. We worked in this state for a long time, and we gave them very early versions of our wraparound fidelity tools right around 2001 and found pretty low scores, and this was before they did any training. After they got training, they got up into half-decent scores, not great, but half-decent. It was only when training and good coaching, intensive coaching occurred, that fidelity got up to these levels that we've seen in those other studies I just showed, gets you to like 80% of families improving as opposed to 50. But after coaching left and the economy collapsed in Nevada and they stopped doing coaching and they just did occasional training statewide, fidelity scores went right back down to borderline to inadequate levels. So the messages here are pretty straightforward. Cicero says fidelity matters. The research shows that fidelity matters to getting to outcomes, and you've got to set up your system to really pay attention to how you keep fidelity high if you're going to achieve the outcomes for families that you want. Okay. Any questions about all that before we now just talk about the tools and then we'll discuss how you're going to use them in Mississippi?
Does anyone have any? No, I think everyone here is just, we had it on mute, but we've just been, everyone's just so enlightened by seeing all that research data. I think it's really, really powerful information, Eric.
You all are too kind. I think that it just must, the salad is probably what's talking there, because
and it's Friday.
It's Friday and it's sunny.
There were a lot of oohs and ahs that you missed because we were on mute. And, I think it just really, it really, I think, makes it real for people to see that we're not just doing this for the sake of doing it. We're doing it because it's going to lead to higher fidelity and, therefore, positive outcomes for kids and families.
Okay. Good. You got the message. It only took 15 minutes to make the point. That's pretty obvious, but we researchers like to show graphs, so thank you very much.
We don't like the scatter plot, though.
Yeah.
The scatter plot was harder to figure out. All right, we'll translate that into something like that. Does that sound better? Okay. So not only is fidelity measurement important to keep yourselves on track and make sure that you're at a level that's going to get positive outcomes, there's other things that doing that kind of data collection can, there's other benefits to doing these things. So when you interview staff or families or give them surveys about their experiences, it helps everyone stay on the same page. People are getting asked these questions periodically. The families are getting the surveys that ask whether things that are supposed to happen did happen. It helps reinforce everyone's understanding of what should be going on. And particularly for staff, that can be important. People can get busy and forget what the big picture here is. Doing the comment, doing the coaching, doing these interviews of the Fidelity tools all help reinforce the model. Team observations not only can be an evaluation tool, but you can use the results in supervision with your staff. When you do a community supports kind of assessment, it can help facilitate state problem solving, or if you have a CME model and have different parts of the state carved up or different regions, it can help keep your community stakeholders informed about and understanding about what wraparound is and what their role is. Altogether, doing this work really helps people perceive that you are part of an accountable process. It increases legitimacy of what wraparound is attempting to be, and it enhances the likelihood of being funded in the future in our experience. People see this as being important as a way of demonstrating to funders and stakeholders that what you're doing is research-based and that you're always dedicated to improving. So let's talk about the tools real quick here. So the Fidelity Index I was describing is the first Fidelity tool we created. The Wraparound Fidelity Index measures how well both the principles of wraparound are being adhered to as well as the core activities. And so it's a 40-item interview, and it's organized by those 4 phases of wraparound, 6 items for the engagement phase, 11 for the planning phase, 15 around implementation, 8 items around transition. And it has 4 different respondent forms, 1 for the parent, 1 for the youth, 1 for the facilitator, and 1 for a team member that could be the same team member consistently, like a family partner, or it could be specific to each team. Every team has got a different type of team member depending on who's most active. But there are 4 different forms, and it's, trained interviewers ask questions and have a conversation with the family and assigns a score on a scale from 0 to 2 for each of those 40 items. And for most items, we're talking about the degree to which the parent or youth or staff person agrees with the statement or answers yes to the item. Or if they disagree that this didn't happen, they would answer no, and the rating of 0 would be assigned. Or you can, using the scoring rules, assign a score of 1, which is in the middle somewhere. Okay. The way this works is that interviewers are someone with real background and experience with evaluation research heads up the project, and the interviewers need to be trained and supervised closely and use the manual for administering the interviews and scoring them. The training that is given to the interviewers includes, an overview of wraparound, a review of the scoring rules, and then what they do is they listen to and score some sample administrations that are online, streaming online, and they complete up to 8 practice wikis listening to an interview being conducted by myself. People get really tired of hearing my voice after a while, but it is a way of making sure that they are practicing and learning the rules. And once they get to a certain level of correct scores, they are officially certified to be interviewers. So that's the WFI. It's a fairly intensive process because you do need to schedule interviews or, over the phone or in person, and you do have to have interviewers who are capable and trained to have these discussions with the interviewees and then assign scores reliably. Because it is intensive, both to do an interview as well as to manage the whole process, we decided to take a leap and create a survey version of the WFI, which again is a measure of adherence to the primary activities of Wraparound. And this is a self-administered version of the full WFI. You can administer it, you can have a staff person or an evaluator administer it by asking the questions, but even more straightforwardly, it can be completed on paper or online by the staff person, the caregiver, or the youth. And again, the same types of forms: caregiver, youth, facilitator, and team member. And here's some examples of what the WIFI Easy looks like. It has a first section that's kind of straightforward, 4 yes or no questions that really get to the non-negotiables of Wraparound. Do you have a team? Do you have a plan? Does your team meet regularly? And is the family's input the primary driver of decision making? If you get a no on any of these, you're beginning to wonder whether or not real Wraparound is actually even being attempted in this place. Most places that are getting any kind of training and coaching from folks like the Institute at Maryland get 99% of these are yes. But then we get into the nuances of Wraparound, and you have a response scale from strongly agree to strongly disagree. So now we're asking folks to give their best opinion about things that represent the details of Wraparound, So did you, in fact, construct a vision statement? Did you describe your vision of a better future to the team? Did you have a major role in choosing the team members? Did your team actually brainstorm and come up with creative ideas for for your plan? Did you, in fact, focus on a small number of priority needs? Does the plan include strategies that address the needs of other family members, not just the identified child, quote unquote? So this is the meat of the Fidelity, the WIFI Easy is these questions. There's 20 of them. And then we ask 4 satisfaction questions because a lot of folks need to have satisfaction data as well. So we said, let's just put it in the same form. And then we even have 9 outcomes questions. So with one form that takes about 10 minutes, you can get satisfaction, outcomes, and fidelity out of your families. The outcomes are in 2 different sections. One that asks very straightforwardly whether some kind of big picture negative system outcomes like getting in trouble with the law, having to go to the emergency room, being suspended or expelled from school occurred, and then it asks the parent or caregiver to ask whether or not the child's problems have caused disruptions in home, school, friendships, and communities. What we'd like to see is that these kinds of things improve over time, needless to say. But it also gives us an opportunity to compare outcomes for different pieces of your system or different levels of fidelity. Okay, so that's about it for the WIFI Easy. It also breaks down into subscales that align with the key process elements or key elements of Wraparound that the Institute trains on. So needs, strengths, natural and community supports, and effective teamwork, as well as whether or not the process is outcomes-based. Are you setting goals and monitoring progress towards them? So you have the ability to look at the scores in these 5 areas as well as total scores for your fidelity. Any questions about the Fidelity Index or the brief survey version?
No?
No question. We're good.
All right. Pretty straightforward. So then we got a team observation measure, and I'm going to go over this quickly. I don't know if this is something you're thinking about, but the team observation measure is another way of getting information, both for evaluation as well as helping to supervise and train and identify needs for your staff in terms of staff development. So essentially there's about 70 indicators. We're creating a shorter version of the TOM right now. But the TOM is organized by the 10 principles with 2 items dedicated to each. There's 3 to 5 indicators in each item. And the observer, who again is trained to criteria using practice observations, scores the items, the indicators yes or no essentially. And similar to the WIFI, there's a pretty rigorous expectation about what the observers have to do to be trained before they go out and do the observations or use the tool. So they get trained, they get a quiz on scoring rules, have to pass the quiz. Then they practice using videos or in pairs with their supervisors. I think that's about all you need to know. Here's some examples of TOM items. These are among the 70 indicators. These are the 6 that we have found to be the lowest observed or the least often observed in team meetings. And some of them are a little bit concerning. The fact that only a quarter of team meetings out there actually are assessing progress towards needs or goals. The fact that less than a quarter are actually generating multiple options for strategies to meet needs. The lowest one, at least from this study, was that key natural supports for the family are actually present at the meeting. Happened only about 1 out of 10 team meetings in this study. But those are some examples of the kinds of things the observers are looking for and rating on the team observation measure. Any questions about the TOM? Just real quick, that's it. And then we've got, yeah. Mm-hmm.
No, we were just going to say they actually use the TOM here. Emmanuel is trained to administer the TOM.
Wow. So, Emmanuel, what has been your experience with using the TOM?
Well, I love the TOM.
I love me some TOM.
I do, but the team assess progress towards goals. I see that as a big issue because you cannot find the progress practically anywhere.
Yeah.
I like for it to be on the plan, and that's so it helps me to determine the difference between one plan to the next. Mm-hmm. And then natural supports is also a big thing.
Yep.
I'm TOM, and this is what I use, to assess the child and family team meetings when I go. And then I just
very cool.
I get them feedback there, and then I also come back to the office and create an email, everything I said to them, and send it to them again, just so they can have something written.
How often, how many TOMs do you think that you're able to administer over a year? How often are you able to get out and do observations like that?
Not as often as you would
right.
like.
But I'm about to kick it in high gear. Mm-hmm. That's why I was obtaining those child and family team meeting dates.
Right.
So when I go to the training, I obtain all the child and family team meeting dates there, and so I'm just kicking in high gear throughout the entire state. And start observing more.
Yeah, because I think that's been the other challenge, Eric, with the TOM is that, a lot of times people aren't necessarily making Emmanuel aware of their meetings. So it's been hard to get some of those observations completed.
It could cancel on the day they tell me. It could cancel, and I have no idea.
Right.
Yep. You drive an hour somewhere, and there's no team meeting.
Right.
Right. That's where the WIFI EZ would be really nice, too, since that can be self-administered.
Right.
Yeah, they assess different kinds of pieces of wraparound. So doing both really gets you some rich information. But I hear you. You're going to get a lot more families assessed if you use the WIFI EZ than you would be able to do with the TOM. But that TOM gives you that in-depth look. I think that the question just becomes, for you all at USM or wherever the Center of Excellence work is taking place, is how do you just build this stuff in as expectations that the providers have to that the providers understand, and that it no longer becomes some kind of accident of good evaluation that you get a TOM, but that it's a real systematic process. Each provider or site or whatever knows that you're going to do 10 TOMs with their staff over the course of the year, and here's the randomly selected 10 kids, and it's up to you to work with Emmanuel or whoever to get information to the family that there's going to be someone there, to Emmanuel about when it's going to take place, and if they don't, well, there might be some sort of consequence. So, or incentive for actually supporting the process, But that's great that you're doing that, and I agree that if you combined the TOM and the Wi-Fi Easy and got good response rates, even from a sample that was purposefully drawn from your overall roles, you would really be onto something in terms of rigorous fidelity monitoring.
Yeah.
Very cool. Okay, so the document review measure we have is something that we developed thinking that it would become part of the set of tools, but what we found is that everyone's documentation is so different that what we really have is just kind of a framework that if folks want to have a document review measure among the tools they're using, they can adapt it to their own documentation, because it really has turned out that it's very hard to have one tool that's used. But the idea here is that you may want to have such a tool that can look at materials such as, the strengths, needs, statements, and other documentation, the plan of care, crisis plan, transition plan, progress notes, and rate how closely to wraparound ideals the information in those is. Do you all have any sort of document review process or measure you're using?
We do on-site compliance reviews, which is what we call our audits. And
right.
Part of our sustainability, in our state plan amendment, we were approved to have wraparound facilitation as a service. So that in itself is the backbone for a lot of new programs, and all the providers keep asking, what's the next step for audits? We know you're going to come and audit us. What is that process going to look like? And I believe this is going to be essential to us monitoring, because we keep telling them, you've got to be doing high fidelity wraparound. That is a non-negotiable. And this, I believe, is going to be exactly what we need.
Well, then we need to work on that. Yeah.
They're also, all of the coaches are trained to use the COMET.
Right.
Aside from Elizabeth at USM, there are coaches, at least in the waiver provider organization, that are doing really well, and using that on an ongoing basis.
Right. So that process and the document review piece of that process can also be a way to stay on track. I think the question, Kim, would be, so when they're talking about needing to do an audit, is that, it sounds as though that's likely to be a separate process from using documentation to collect information for coaching.
Yes. It is. It is a different process, but the COMET data would feed into the state's internal reviews. Do you know what I mean? Like the data.
Yeah, that's good.
But it is a different process from an audit perspective. I just, wanted to make sure that you knew the data was feeding into them, from the state.
Well, that would be the challenge, is just to make sure we're not duplicating effort, or to make sure that that information is available to other parts of the quality assurance process that you have going on.
Yeah. Yep.
So finally, we have this CSWI, which is this tool to measure how well a state or a system supports implementation of wraparound. And it's based on a research-based framework, and it has 40 items. And the items are grouped within the 6 primary areas of community or state support that's needed for wraparound. Community partnership, are the right stakeholders at the table at a state or a community level? Collaborative action, are they actually doing things together that demonstrate good partnership in support of wraparound, MOUs, fiscal agreements, agreements around sharing information with one another, in high-level support to staff attending wraparound team meetings. Fiscal policies, so do you have a case rate that's adequate? Is it flexible? Are the funds flexible? Are they capable of ensuring that any strategy that's been brainstormed to meet a need can be paid for if it's within reason? The fourth one is the service array. Wraparound's only going to be as effective as the types of strategies and services that are in plans, and so having evidence-based services and an adequate array of services available to teams is critical. Human resource development, such as training, coaching, supervision, and of course everyone's favorite item, which is compensation to wraparound staff. Is it adequate to keep staff from turning over? And finally, accountability. Are you actually measuring fidelity and outcomes? Which, needless to say, you guys are getting a good jump start on. And so this is something that if you're so interested, stakeholders in your system, including the staff and the system partners, family advocates, state agency folks who know the wraparound program, complete a 40-item online survey. It takes about 25 to 30 minutes. And the CSWI can help you guys compare yourself to other states and sites out there in our national sample to see how well you are supporting wraparound, help you understand your relative strengths and weaknesses in areas in which you need more policy or resource development. And it also can really help, this last bullet here, help your groups understand, the second bullet, help folks understand what wraparound support needs to consist of. What you get are these cool pictures of your system. So this shows a particular site. You always have the national mean here to compare yourself to, these green diamonds. And your site would have a score plotted against the national mean. So we see that this site is right at the national average overall. But if you look at the profile across those 6 areas, they actually have very poor supports in terms of fiscal sustainability and collaboration at the top. They're very strong in terms of human resource development, training and coaching. So this is the picture of the kind of place that perhaps got an infusion of dollars and spent it on training and coaching up staff, but maybe hasn't been able to achieve some other things that are very important, like making sure that all the child-serving systems understand wraparound and are supporting it, or pulled together a children's cabinet or a community collaborative that's supporting wraparound. We see this kind of profile out there in the field quite a bit. We also see the opposite, where people are just organically saying at a high levels, we want to support this idea of wraparound because we want to keep kids from going into residential or whatever, but then they don't allocate enough support to training, coaching, and so forth. So anyway, the CSWI can help you kind of take a hard look at your system locally or statewide and ask where you need to be focusing your efforts. Then you can get into each of the themes at more micro levels. And so looking at the human resource development theme for this site, again, the individual items can vary greatly. So this site, people really have a well-crafted job description. Supervision is good, but folks are perceiving that the pay for wraparound staff is really inadequate. No matter how much you train folks, maybe caseload sizes are nice and low, there's clarity about their role, but if they're not getting paid enough, they might turn over anyway, and that's something you're going to have to take a look at. All right. I'm pretty much done with my overview here. The one thing that's important to know is that all of these different tools can be entered into a data entry and reporting system called WrapTrack, and can provide a way for folks all over the state who might be collecting these data to enter it all into the same place without having to trade files around. And it also allows you to spit out reports anytime you want of a whole bunch of different types. Have you guys used WrapTrack down there in Mississippi with any of your WFI or TOM data collection?
He wants to know, do you use WrapTrack?
No.
I'm not sure, Eric, that they've ever heard of it or know that it exists.
Right, so one of the things that's a little bit confusing about our PRTF waiver states that you guys are working with is that they don't necessarily have to kind of formally sign up for the tools, which would give them information about all this stuff in training. So we might need to figure out how to overcome that, Kim.
Right, yeah, I agree.
So that's something that we're going to have to do. I'm not going to talk about WRAP TMS unless you think there's any reason to, Kim. What do you think?
Jen, so TMS is the web-based, information system that care coordinators can use. Do you have interest in seeing any of that or knowing about it?
I do think this would be helpful if we're looking, next year once we completely turn this over to the University of Southern Miss and we're sustaining in our state on our own and looking at monitoring and data collection. I don't know what this involves, but I know there's probably licensing fees, user fees, all that. How we would contract with that, with the Department of Mental Health, Medicaid, Southern Miss. So I guess in a nutshell, we would like to know, I guess, if there's a way to do a brief overview.
Sure. Let me pull up a better PowerPoint that I got. Hold on one second here.
If we have time.
There's also two different, while Eric is pulling that up, Jen, so the WrapTrack stuff that Eric referenced is really specifically for the data collection around the WFAS tools, and it gives really fancy reports, and it's really cool, easy to use, that kind of stuff for like data management around WFAS. And then TMS is really designed to support wraparound implementation. So like, where, for instance, like Youth Villages has a, system where you can go in and, create plans of care and do that kind of stuff. Like this would actually replace that. So if you guys wanted a single system across your whole state where everybody, like the community mental health centers, the providers, whatever, whoever was doing wraparound had to use this, they could do that, and then you guys could have access to those electronic records.
Okay, that clarifies it, and I think through balancing incentive funds, through the BIP program, Balancing Incentive Program, Christy is actually working with a lot of people, a large group, long-term systems and supports, LTSS, and I believe they are trying to implement some kind of one-stop shop, if you will, where I guess multiple agencies go in and use the same place, kind of a no wrong door entry assessment, plan of care. So I think our state is already in the process of doing something that sounds like what you just described for this program. So I guess maybe would be more appropriate. If
Okay.
we're looking at, you know, being able to enter it, use electronic forms, pull reports, that kind of management stuff.
Okay.
Right, so RapTrack is about entering the data from the tools of the WFAS, the Wi-Fi, the Wi-Fi Easy, the TOM. What RapTMS is something much more sophisticated and much more involved, which is an electronic behavioral health information system. So this is a wraparound specific electronic health record. So, you know, something that is, this is, you know, all of the features. Can you guys see my screen here?
Yes. Well,
so it's got all these features of any electronic health record that you would really need to have for any kind of service delivery. HIPAA and FERPA compliant, it's cloud-based, it's secure, it has automatic upgrades. You essentially purchase a license agreement with the developers, which is ourselves with an entity called Social Technology. And you know, so it's got all this ability to have login from any web-connected computer, and then as a care manager, for example, or a facilitator, you'd be able to have, you know, you go straight to your dashboard, and you can, you know, start looking at your youth records. Once you get into a youth, it shows you a dash. Yeah.
I'm sorry, are we supposed to see something different than just the home page? Did you pull up a separate PowerPoint?
I did. Are you not seeing this?
Not that. All we can see is the home page, the one that you had said, yeah, the last screen that you showed us on the actual webinar.
Oh, I guess I don't really have control, I guess. All right, well, I'm going to go.
Well, wait, Adam, are you on? Can you give that to Eric?
Yeah, hi, Eric, if you go back to the webinar.
Yeah.
And then on the left-hand corner, it says there's a tab where it says share. If you click share and then share my desktop, that should be able to.
Okay.
Yeah. There we
Yep.
go.
That worked. Okay, now we're.
Thank you, Adam.
Thanks. So you see this now?
Yes, we do. Thank you.
Right. So what I was scrolling through is just, you know, again, like you would see with a lot of different electronic health records, you know, you can log in, your facilitator is entering information about youth, and so therefore once you've got your youth information in the system, you can go to a dashboard where you can look at a clipboard view of your kids and click on one, or go to common functions of the system. You can go to a dashboard view that shows you how many youth you've got enrolled. You know, so a new youth was added here in September for this facilitator. They have 11 folks on their caseload. It'll show you what their living situations is. That's kind of a dashboard view. You can go to a reminder tab that shows you what are the things that are coming up. You know, do you need to have a team meeting is coming up, a plan of care is due, maybe Fidelity data is due. So these are kind of the tabs that the facilitator would be able to go to through this electronic health record. In terms of entering the information that then you can use the TMS system to review, you know, this is a new youth record, so if you refer to new youth, this could be done by your administrative person, not necessarily the facilitator. They could enter all this stuff on a new referral or a new enrollee. Facilitator can be looking again at different dashboard views that shows how long a youth has been enrolled, you know, what their status was over time. So they were pending for X number of weeks and they were enrolled, etc. So there's just all these different views that you can have, but at a most basic level, the whole point of this thing is that one place that the supervisor, the managers, the facilitator, even the family members, with a password-protected hierarchical kind of approach, can get the information they need about the kid, the team members, the plan of care, the crisis plan, all of that stuff. All you do is just click on a tab and enter the data or print it out for a team meeting, or send it to a supervisor or to you know, a representative of the different agencies that might be working with the kid. You've got secure document upload and so forth, electronic signature. The thing is really cool, and it is under development, but just wanted, it sounded like you might be interested in knowing about that. The Wrap Track system is, I'm trying to see if there's anything else fascinating. Oh yeah, there's always one thing that people really like is, you know, you can put in your own specific reminders to yourself from your tablet or your phone or your desktop. You know, buy a card for Simon's mother. Make sure that that's something that pops up on your dashboard when you log in. And then there's this workflow pane that for any kid, it will tell you which tasks that are pretty critical to Wraparound have been completed versus still need to be completed. So for a new kid, entering the referral form, assigning the facilitator, the family vision statement's been entered, the strengths list has been entered, the crisis plan's been entered, but other things haven't happened. There hasn't been the team members haven't been entered, team meeting hasn't occurred. So this is a way for each facilitator to stay on track with each individual kid that they're working with, and it'll show you like how close to the completion of things that are needed are you. So anyways, that's Wrap TMS. Wrap Track, I don't have anything here, but it really just is, you know, what we need to do, I think, is to get you set up with, trying to get back to my, oh, here it is. I'm going to stop sharing, Adam. Go back to this view. We don't have anything on Wrap Track, but the bottom line with Wrap Track, I think, is just simply that we need to get you all oriented to how to use that system, especially if you're going to put together a Fidelity monitoring plan that's a little bit more systematic than even you have now. You're going to want to use that system to enter the data and so forth. It doesn't sound like you're doing it now for the tools you are using. But what it basically does is similar, it's on the same platform as this Wrap TMS system, where you have password protected logins, assignments at different levels. So people who are collecting data like Emmanuel will have one level of permission, but he might not necessarily be able to see the whole system worth of data. That level of permission would be reserved for managers or supervisors or administrators and so forth. And so you have this hierarchy of access that you just assign your staff who are working with the Fidelity data at different levels. And you can run reports whenever you want. So that's kind of it for my overview of all this stuff. Get through this. I don't know. What do we need to talk about in terms of what Mississippi is going to do going forward?
What does it take for us to be ready to use Wrap Track? What kind of training? What would the cost be? And I say that because we have sustainability funding still left from the CAPRTF demo that if we do not use it by September 30th, 2014, it is gone. We will not have access to it on October 1. And we primarily wrote in our plan that it's, you know, we wanted it to be around evidence-based practice. We've already committed a portion of the money to our Wraparound Center of Excellence, name to later be determined, and got Arnika and Elizabeth on board and have moved forward with that parallel plan to transition to our own sustainable Center of Excellence. But I would like to add this as a component, and just, I know time is of the essence, and so what would be the quick version of the bullet points of how to get that up and running for Mississippi?
Sure. So there,
have access and training.
Right. So this is the deal. So you all have got, because we're evaluating Maryland's work in the PRTF waiver states, we've just been providing a support kind of role and have provided the states in PRTF until the waiver period and until the project ends with whatever support they need, including access to the tools, which is why you're able to use the TOM as you see fit. What we typically do with states that aren't in that kind of a position is there's a license agreement for whichever of the tools you want to use, and depending on how many of them you want to have access to all the materials, the tools themselves, the training toolkits, etc., there's an annual fee, which is really pretty reasonable given all of the back-end stuff we've developed, including that data system. So a few $1,000s a year is generally for a state, depending on how many sites you have. Because it becomes more complicated if you've got multiple jurisdictions or provider agencies that you want people to have unique logins for. How many units of effort are there out there statewide, or will there be, in terms of unique sites or providers or whatever?
Jen, how many regions do you guys have in Mississippi again? I can't remember right now.
There are
15 or 16?
15, or I think it's 15 community mental health centers. And then our CAPRTF providers, which one is a community mental health center, so we won't count that one twice. So we're up to 17. And then any other private mental health providers that wanted to come on board based on that new provider type that we opened up recently.
Right. You're probably looking at no more than 20, though, Eric, I wouldn't say. 20, 25.
Right.
Correct.
So if you wanted to, so I don't know, like, for instance, what, the Center of Excellence is going to want to define as kind of the units, but if they wanted to define all of those different pieces as the individual sites that you might want to get unique data for, or have permission for folks at each of those sites to be able to look at their data, typically that's what people do. Then the pricing for the annual license would be based on that number of sites or provider agencies. And typically, I got to remember the specifics, but we usually charge like $1,500 for an annual license for a tool, and then a couple $100 per site because of the added back-end effort that's necessary to manage all of those different permissions and so forth. So what you're looking at is probably like somewhere around $6,000 to $8,000 a year for the tools, and having permission to use them and give anybody and everybody out there in your state access to the Wrap track, to the training toolkits, et cetera, training by us as needed. And what it sounds like would be useful would be for you all to potentially prepay for the use of those things for a few years in advance if you have adequate resource, and then you would just be able to keep using them for the number of years that you want to prepay for using your PRTF resource.
Yes.
So essentially at that point, if that's the idea, and is that I would just go down the hall to April Sather, who is our program manager, and let her know who she should contact about the details. Which tools do we anticipate you want to have access to? What I'm hearing is maybe TOM and Wi-Fi Easy, and run the numbers so that you get a more specific estimate, or not estimate, just a more specific figure about what the annual fees would be. And not only would, does that get taken care of pretty quickly, you just get an invoice and for however many years you want to prepay for. But then the real work begins, which is for us to start talking with you about how to get the relevant people trained on both the tools as well as the data system. And we do that by webinar. and you have access to our folks, including me, around any sort of evaluation design decisions. How do you sample your families? How many do you need to have in a sample? How often do you need to give the survey out? If you do have 20 sites and you want each of them to have a stable estimate of fidelity, how many would you need to sample from each site? You know, who would be your people who get the surveys administered out there? How do you interpret the data? So all that stuff would come with that kind of subscription, so to speak.
This is Tim. I finally joined in. Sorry for the delay.
Hey,
but if,
Tim.
Hey. Can we? Thank you. And now my computer stopped, so you know I can't even do the webinars. I don't know what happened with any of that, but it sounds like I missed that part anyway. So, but I have a question about paying forward, because I'm guessing that kind of what would be each of the units isn't at the same developmental stage in terms of what they would need.
Right.
Is it possible for what's paid forward to be a standing credit, so as we bring on units who would have then be ready to bring in more stuff, that it could be, we could have staggered starts for units? Or is
yeah,
it
that's a real
practical for the whole state?
Yeah, that's a practical idea, and it would be totally doable. You know, we've encountered this increasingly with folks who have system of care funds that are ending, PRTF, et cetera. It's nice to meet you, Tim, by the way. All this was recorded if you want to like have some leisure time consumed by watching a pre-recorded webinar about
I know, I was
Wraparound.
thinking I could do that with a bottle of wine and I'd probably be set, right?
There you go. I think that sounds about right.
Tim, you will enjoy this webinar. You really will. It's a lot of
I'm sorry I missed it. I am. And I'll try to look at the recorded version.
Well, you won't have the wine right now, so later on with the bottle of wine, you'll really enjoy it.
And I'll enjoy it more than y'all did.
I don't know. You didn't hear about these salads that those ladies had.
Well, that's
pretty good. But in any event, I think that's very practical, and I think that, you know, the question would just be, you know, I think what you would do is, you know, at some point between now and September, you would just say, okay, let's talk about year one and what it is you want to invest in terms of the number of sites that would have unique logins and capacity for you looking at the their individual fidelity scores. And that would be the basis for your first year's license. And, you know, depending on what your needs are and your resource, then absolutely, we could figure out a way to invoice you, but recognize that it'll be a flexible application going forward.
And then I would imagine that there's an administrative hub for all that as well. So if you're selling that by unit, if there's kind of the primary central, if it's me, for example, for accessing everybody's data, is that a separate unit or is that included as part of
That's kind of the base. There's a base of like 1,500 for the, you know, regardless how many sites, that's kind of the hub. And then each site, you know, beyond that would be unique is a much smaller increment up from, you know, depending on the number that there are. So yeah.
Okay.
There's a logic to it.
I'm sorry to ask because you may have covered it. Is there typically in the state a single person that ends up being kind of the assessment person?
It makes it a lot easier when, you know, there's a master user in a state or an organization. That person is going to be responsible for assigning, you know, identifying the subsites and the person who would be the primary contact at each of those providers or regions or whatever, however your state is organized. And yeah, so having somebody at that hub who we know is the go-to person for a state is pretty critical.
Okay. Yeah, that exhausted my questions. The rest of y'all have to ask the questions now.
Well, I think that, you know, the bottom line is that, you know, this is the overview. You got this recorded for folks' future basic information. And the two steps that would be next would just be simply getting access to all this stuff, which again, you know, is essentially free until the end of September because of the role we play with the PRTF evaluation. We can get you set up with all that. Think about the resource going forward before it's, you know, too late. But the big thing is then just, you know, getting back on track with, you know, well, what's your evaluation plan? Who would be the hub? How many sites are you going to be looking to do this with? What kind of sampling strategy will you use, and how will you get the data collected? And we'll be happy to play that role with you.
Okay.
So Kim and Jennifer, does that sound, what do we need to do to kind of, who's the person with whom April, our program coordinator, needs to talk about just getting the logistics set up and, you know, find out who your folks are that would need to get trained on RapTrack, make sure you got access to all the materials and so forth?
It would come to me, Jennifer, Grant at Medicaid, and Kim can share my email and contact information.
I think I've got it.
Okay. I think I've emailed back and forth with April before.
Oh, okay. Well, then she'll know how to find you. I'm literally going, when we're done here in a couple minutes, I'm literally going to go down the hall and tell April to get with you about getting set up formally.
Okay, great.
And Jennifer, are you thinking that that would stay connected to Medicaid and distributed through Medicaid, or is that going to be connected through the subgrant with me? Or both?
Probably shift to the subgrant with you. I'll have to talk to Bonnie.
Okay. Well, we can talk about kind of what that plan would look like.
Yeah.
All right. Well, Kim Eastep or anyone in Mississippi, are there any other kind of questions or information needs for this phase of the work?
I don't think so. I feel like as they start to roll it out, like Tim may have more questions, you know, as it rolls. But Adam will send out the link for the recording. So, Tim, you can grab your glass of wine and watch it. Or if somebody would like to watch it, you know, twice, that would be.
That's right. I'll have the first show early next week in my office. Y'all come.
Yeah. But no, I don't think so. I think that it was good timing to kind of prepare for the ending of the waiver and, you know, what does it look like as it continues to move forward and as they set up their Center of Excellence in Mississippi. So it's exciting.
It is very exciting.
Mm-hmm.
It is exciting. And so Adam will send the link to the recording to Tim as well as Jennifer.
He'll send it out to the group so everyone can have access to it if they would like.
Okay, sounds great.
Mm-hmm.
Well, it has been a pleasure, and I hope graduation was good, Tim, and it's good to meet you, however briefly. We'll be interacting, I'm sure, in the future.
I hope
Very
so.
exciting.
I'll look forward to it. Thanks.
Okay. Jennifer, stand by to hear back from April probably early next week.
Absolutely. Thanks so much.
All right.
Thank you, Eric.
Thank you.
Okay, take care, everybody.
Thanks.
Thanks, everybody.
Bye.
All right. Bye.
Bye.
Is everybody gone?